hydrogen peroxide can be an effective antiseptic for cleaning minor wounds when used correctly. It helps to kill bacteria and prevent infection, making it a valuable addition to your first aid kit. However, it should be handled with care to avoid irritation or tissue damage. Always read the label and follow the instructions to ensure safe usage. Below is a professional, detailed guide for safe wound care. Following these steps will help you manage minor injuries effectively and safely. Title: What you'll need on screen text. Hydrogen peroxide, 6% solution, sterile water, for dilution if necessary. This can help reduce the concentration of hydrogen peroxide if needed. Cotton balls, gauze pads, or a clean cloth. These are essential for applying the hydrogen peroxide to the wound. Gloves, optional but recommended for hygiene. Wearing gloves can help prevent contamination and protect both you and the patient. A sterile container or bowl. This is useful for holding the hydrogen peroxide or sterile water during the cleaning process. Bandage or dressing, if needed. After cleaning the wound, a bandage or dressing can help protect it from further injury and infection. Assess the wound. Ensure the wound is minor, such as a small cut, scrape, or superficial burn. Avoid using hydrogen peroxide on deep wounds, puncture wounds, or serious burns, as it may damage deeper tissues. Wash your hands thoroughly with soap and water. Alternatively, wear gloves to maintain hygiene and prevent contamination. Prepare the solution. If the wound is in a sensitive area, such as near the eyes or on delicate skin, dilute the 6% hydrogen peroxide to 3%. Mix equal parts hydrogen peroxide and sterile water in a sterile container, using a 1-to-1 ratio. First, clean the wound area. Rinse the wound with cool, clean water to remove visible dirt and debris. This initial rinse helps reduce the risk of infection. Next, apply hydrogen peroxide to the affected area. This is an important step in ensuring the wound is properly disinfected. Moisten a cotton ball, gauze pad, or clean cloth with hydrogen peroxide. Make sure it is thoroughly soaked but not dripping excessively. Gently dab or wipe the wound area with the moistened material. Be careful to cover the entire wound surface to ensure it is fully cleaned. For larger wounds, pour a small amount of hydrogen peroxide directly onto the wound. This helps to reach deeper areas that might be harder to clean with a cotton ball or gauze pad. Expect bubbling as the solution reacts with blood and tissues. This is a normal process that helps clean the area. The bubbling action indicates that the hydrogen peroxide is working to disinfect the wound. Wait and observe. Allow the hydrogen peroxide to sit on the wound for 1 to 2 minutes. Avoid prolonged exposure, as it can irritate or damage healthy tissues. Rinse the wound. Use sterile water or saline solution to thoroughly rinse off the hydrogen peroxide. Rinsing helps remove any residue that could irritate the skin. Dry the area. Gently pat the wound dry with a clean gauze pad or cloth. Ensure the area is completely dry before applying a dressing. Protect the wound. It is crucial to ensure that the wound is kept clean and covered to prevent any potential infections. Cover the wound with a sterile bandage or dressing to prevent further contamination. This helps in keeping the wound environment clean and promotes faster healing. Change the dressing daily or whenever it becomes dirty or wet. Regularly changing the dressing ensures that the wound remains free from bacteria and other harmful agents. Title: Precautions on screen text. Frequency: limit hydrogen peroxide use to the initial cleaning. Overuse can be harmful. Repeated applications can delay healing by damaging healthy tissues. It's important to use it sparingly. Sensitivity: if irritation, redness, or pain occurs, it may indicate an allergic reaction or sensitivity to the product. Discontinue use immediately and consult a healthcare provider. They can recommend alternative treatments. Deep or infected wounds. Seek medical attention for deep wounds as they may require more intensive care. Wounds that show signs of infection, such as increased redness, swelling, or pus, or those that do not heal within a reasonable time frame. Persistent wounds may need specialized treatment.